Your lungs are an incredible organ of respiration. The average human lungs have around 250 million alveoli, the delicate grape-like structures where gas exchange takes place across a microscopically thin, permeable membrane. Oxygen from the air you breathe crosses the membrane and bonds to hemoglobin in the red blood cells, which at the same time relinquish the carbon dioxide waste produced by cellular respiration. Your body needs a lot of oxygen for life, and the lungs are staggeringly effective at providing an efficient way of extracting it from the air and allowing the cardiovascular system to pump it to every cell in the body. As Bill Bryson says in his entertaining book, The Body, A Guide for Occupants, if flattened out, your lungs would cover an area the size of a tennis court, and the airways within them would stretch from London to Moscow. But the lungs cannot make breathing happen on their own. The soft, spongy tissue of a healthy lung contains enough elasticity to assist you in breathing out. That's why exhale requires so much less effort than inhale. However, it is muscles around the lungs, the muscles of respiration, that enable you to breathe in and out, with a little help from the laws of physics. At sea level, air pressure is just below 15 pounds per square inch. At the top of Mount Everest, 29,000 feet, it drops to just over 4 pounds per square inch. Humans are best adapted to breathe at sea level or thereabouts. Air pressure is significant to breathing. If we blow up a balloon, we increase the pressure inside. If we release the nozzle, the air rushes out to equalize with the pressure outside, leaving a limp, uninflated balloon. Your breathing muscles make use of this law of physics by alternately decreasing and then increasing air pressure in the lungs, resulting in air rushing in and out of the body. On a full inhale, the diaphragm, intercostals and some neck muscles expand the chest cavity to which the lungs are attached via the pleural membranes in the pleural cavity. The expansion of the lungs rapidly drops the air pressure inside, and air rushes in to equalize internal and external air pressure. When you exhale, the elastic recoil of the lungs, movement upwards of the diaphragm, and the internal intercostals all cause a reduction of space in the lungs. The resulting rapid rise in air pressure causes air to rush out of the body. So our muscles of respiration act to change the shape and volume of the chest, thorax, which leads to air pressure changes inside the lungs, which in turn leads to breathing. Let's now look a little more closely at the individual muscles of respiration and how they work.